And I'm going to go ahead and let people in. Hello, everyone. Thank you so much for joining us. I'm seeing people slowly get into our audio. And this is the fun part at the beginning where I, Jessica, from the Oregon Health Authority, spend a little bit of time just making sure everything is working well in the Zoom, making sure you can hear me. Damaris, I'm wondering, can you take us to the Zoom tips slide? And I'll spend a little bit of time talking through that before we get to our main content. Perfect. Hi, everyone. I am so glad you're here today. We have a few Zoom meeting tips that we are putting up on the screen while people join the Zoom, get fully up and on board. And here are a few reminders. We have a lot of people here in this virtual room today, so if everyone can stay on mute when they're not talking, and that also means that using the chat is a really great tool for being interactive without us all ending up talking over one another. So feel free to use the chat at any point in time. We also save the chat, so it's a great way to make sure that any questions, comments, concerns, ideas that you have make it to the right people within OHA. We also have this handy dandy feature in Zoom where you can raise a virtual hand. And that's also a great way to interact with us, and we can then call on you and have a somewhat orderly conversation. I do think I see a note that people can't enter from the waiting room. I think there are some people who are persisting in our old link that got retired. And so if you have a colleague who is not having success getting in right now, then I'm going to put a Zoom registration link into the chat. If you all can help us get the word out to your colleagues, to anyone you know who is reporting to you they can't get in, we're actively adding people from the waiting room right now. There is a chance some people are in a different waiting room that we don't have access to, and I'm so sorry about that, but we can work together to get everyone over here. And as we continue to admit people, looks like we have a lot of activity still as we're getting people in. So I'm going to keep talking until we stabilize a little bit. Another piece of good news, if anyone is having technical difficulties, can't access right now, this webinar is being recorded as we speak. The recording and the slides go onto our public website. So you can re-access this content later, as well as share it if there's anyone who isn't able to make it today. We do also have live captioning today. So the easiest way to get to our captioning and transcript is you should see a little icon that has two C's in your Zoom toolbar. And if you click that, then the captioning will pop up. Thank you to our captioner today. And I'm continuing to let people in. But I think we're getting close to stabilizing. Okay, so with that said, Damaris, can you take us back a slide? Thank you so much. Hi, everyone. This is our All Come webinar for Oregon's 1115 Medicaid waiver in the month of October 2024. Thank you so much for joining us today. We have a lot of great content in store today. And my name is Jessica Diaz. I work for the Oregon Health Authority. I am your facilitator, but I'm going to hand you off very soon to our great presenter today. If we can pop 2 slides ahead. And thank you. I'm keeping you on your toes today. Perfect. Here's our agenda for the webinar this morning. We are going to make sure we're all on the same page with some background information on what we mean when we're talking about the 1115 Medicaid waiver here in Oregon. We are going to go over health-related social needs, also known as HRSN, housing service definitions and timeline, as well as those health-related social needs outreach and engagement benefits, an update on the community capacity building funds, an update on climate devices, and we'll round out the session with a question and answer time. Next slide, please. This is the part where I hand it off. Steph, the floor is yours.
Lovely. Thank you so much, Jessica. Hi, everybody. Good to see you all. My name is Steph Jerem. I use she, her pronouns, and I'm currently the 1115 Waiver Policy Director. I'm here again to talk to you about where we're at and our monthly updates. If you go to the next slide, please. Per usual, I'm going to start with just our general background on what we're talking about and ground us in this. So we are here to talk about the Oregon Health Plan, which is what we call Medicaid in Oregon. It's the nation's public health care program. It is free health care coverage for low-income children, teens, and adults living in Oregon. You can apply at any point in time during the year. And this is what we call our Medicaid OHP program, and it's delivered by our coordinated care organizations, or CCOs, and our fee-for-service or open card program. Next slide, please. Any Medicaid program has to follow rules that are set up by the federal government in order to get the funding that supports this health insurance program. But states are able to ask to change those Medicaid rules in certain areas, like adding benefits or new benefits or expanding coverage. And when we ask for that, we enter into an agreement with the federal government that says, hey, we want to test out this new way of providing Medicaid in our state. We think it's going to be really good. It's going to create great outcomes. It's going to be lower costs, those types of conversations. And so all of that gets approved in something called a Medicaid waiver. And there are many types of waivers, but we are here to talk about the 1115 demonstration waivers. Those are all terms you'll hear. And if you go to the next slide, our key changes here are that we have continuous OHP eligibility and enrollment for children up to age 6. So anytime that they are eligible for OHP prior to age 6, they will just stay on it. That's really exciting. We were the first in the nation, and many states have followed us on that. We have 2 years of continuous enrollment for everyone else. There is coverage for health-related social needs supports, and so we're going to be talking about that today, including some of our upcoming, just a couple weeks out, our housing launch, which is very exciting. Coverage for young adults with special health care needs, and then coverage as well for a small set of services for people who are leaving a carceral setting, like a prison or a jail, 90 days prior to their release. That's something we recently got through our final negotiations on in that space as well. So that's our overall waiver. And if you go to the next slide, today I'm going to speak specifically about some of our upcoming new services that will be launched in November, specifically around housing. So the next slide, please. The goal of our health-related social needs, or HRSN housing supports, is to help people stay in current housing and prevent homelessness. This is a program that's going to be available to some of our OHP members on November 1st, 2024, and we'll ramp up from there in terms of how we're able to provide those services. I will get into the actual services on the next slide. So the benefit, you can go to the next slide. Thank you. These are the types of services that we can expect to see being available to some OHP members starting November 1st. There are housing tenancy sustaining services. This is a group of services that help with things like case management or coaching of and lessons and conversations on how to work with a landlord, how to, be a tenant that can remain in housing, lots of other types of supports to help people stay in their home. For some people, they will be eligible for rent for up to 6 months, including past due amounts, utility setup and costs for up to 6 months, which also can include past due amounts, and storage fees in some situations. And then there are also some supports around medically necessary home accessibility modifications and remediations. Bunch of big words there. What that really means is that if somebody is in a situation where, perhaps they have recently had an injury or have become disabled and would benefit from a ramp or a grab bar installation in their home. And that will be the difference between whether or not they can stay in that home or have to find new housing. We really want to support them in being able to stay in their home. Other examples would be, in cases where perhaps there is a hoarding condition, and they would be evicted for that. We will be able to come in and support some heavy duty cleaning, keep that person in their home, and be able to support them during that time period while that cleaning is occurring as well. So those are, again, really trying to keep people as much as possible in the homes that they're in and not contribute to that person ending up in a pathway towards houselessness. You go to the next slide. This one is a little bit of this slide and the next slide. I will say they seem like there's a lot on there. I'm going to walk you through it, but this is a slide for you to reference back to as needed. So in order for somebody, an OHP member, to get rent and tenancy services, these are our highest cost items. We're really excited to be able to share these, but not everybody can get rent. We don't have a budget for that. So what we've needed to do is work with the federal government, both our healthcare side of the federal government and our housing side of the government, and come together on what we agree on, because we always want to link this to improving health. So what we want to see is an OHP member that is currently housed and needs support staying housed. And they have to have a lease or written agreement with their landlord. And that's pretty flexible about what that looks like. So you're in a situation, an OHP member is in a situation where they're at risk of losing that housing, doesn't have an eviction letter in hand, but maybe missed rent for the first time or something like that. The second expectation is that they have this at risk of becoming homeless. This is a federal definition that we are working under. And so this has to do with the income of the individual or household and the area median income, which is a income threshold that our housing partners are really familiar with and will be able to help calculate. And that person has to not have anywhere to go. They don't have someone that can help pay their rent. They don't have another house that they could go to or go stay with a family member. So we're really in this situation where if there isn't a service that can help step in, that person is in a trajectory again towards houselessness. And then the last piece is our healthcare side of things and our medical health condition side of things. All of the conditions that we have on this screen here are ones that we have said are housing clinical risk factors. So we know that if you have one of these and you're at risk of becoming homeless, that it would be exponentially worse for you in that healthcare condition. And so you'll see here, all of these situations are ones where there could be a real destabilizing effect. We don't want anyone to become homeless, but these in particular, we know that there are links to severely worsening situations for their health as they become homeless. So those are the 3 eligibility criteria areas. I went in detail on this because I know we are actually ramping up towards the services going live. And I know that we're active in the chat. So if you have questions, feel free to drop them in there. We have our subject matter experts there ready to answer questions. So this was for rent and our tenancy services. Our next slide shares a little bit about those home modifications and remediations. If we could go to the next slide, please. These are the grab bar, the ramp, the pest control, the clean outs. And so the eligibility criteria is a little bit different for these to be responsive to what the needs are in this space. So for this one, you're looking at these are the clinical risk factors, the same ones that you saw in the last slide. Then they have to belong to one of our covered populations. All of these populations that you see on this list are the ones that you'll see scattered throughout waiver and HRSN categories, because these are situations where someone is crossing across a system or a time period that makes them especially likely to lose coverage or lose the continuity of care. So we're really trying to create that wrap around support for them, especially as it relates to their housing. And then finally, they have to be in a home where that modification or remediation, that change to the home, will really help prevent worsening health conditions, and the landlord has to agree. So those are the pieces for the home modifications and remediations. So a change to the home environment to keep someone safe and healthy in their home. Okay. The next slide helps us break this down to more tangible, like who are we really talking about here? So the examples of our eligible populations are, here's an example of someone who has a chronic disease that qualifies, behind on their rent because they lost their job, and needs rental assistance until they're able to replace that job. So again, this is a short-term situation that we want to be able to help with. Maybe they have a serious medical event like a hospitalization or a broken leg. Perhaps they need to go into substance use disorder treatment, and they need rental assistance while they're unable to earn that income. We really want to help them be able to get through that time period, ensure their health is stabilized, and then return to their housing in a situation where they're not then additionally looking for housing or in a worsening situation. Something that's unique, when we think about the waiver in the context of the whole state, is that if a family has moved into a friend's home, that's considered doubled up. And maybe the friend is okay with that, but it actually puts a strain on utilities, and it puts a strain on some of the housing needs. And so they've asked for rent from that family, and we can support that. This is not meant to say we want to see this forever, but it can help stabilize during that time period. You'll see a lot of what we're really trying to get to is stabilizing, preventing worsening situations in that prevention space. Perhaps the family's at risk of eviction due to the severe lack of upkeep of the home, and those chore services would be able to help them reset, maintain that housing. Or lastly, there could be a child that has special healthcare needs and needs hospitalization or care treatment where the parent needed to take time off work, doesn't have the sick leave, and we want to be able to support that time period while those needs are taken care of and the parent can get back to work. So those are some of our examples. Again, you'll hear me saying a lot around prevention, acute, like a short time period where we know that this is going to help make a difference. We're trying to think about where Medicaid and the waiver fits within the overall structures and services in our state, who are helping out in other ways with other populations as well. Next slide, please. The other really exciting piece of the waiver that is expanding in November has to do with the outreach and engagement that goes along with housing. Some of this launched back in March with our climate benefit, and some of this will also launch in January when we get to nutrition. But for right now, I want to focus on the outreach and engagement opportunities that go along with housing and will be really important to the success of this program. Next slide, please. Our goal of outreach and engagement services is to, first of all, find and identify the members who could be eligible and help them access those services. I think this is new in a lot of cases. What we've heard from some of our housing providers that members aren't necessarily showing up until they have the eviction notice in hand. Well, here's a program that can really help in some of those early stages when we're first recognizing that there could be a risk of being unable to pay rent. So helping identify who those members are, helping them access the services and go through the process. We know that it's going to take some time to actually deliver rent and to go through the screening process. And so this is not meant to be, 24 hours, we need help situation. This is really meant for that first step. I have to, I'm in the hospital, likely going to lose my job situation. We also have the opportunity to have a connection for members to other healthcare and non-healthcare services to really think about that overall health well-being needs. And so opportunities for outreach and engagement to really help a member and say, let's go through the list overall. What are the needs that we can help you with, and how do we connect you to that? How do we refer you to that? We also want to see that the outreach and engagement services are readily accessible, culturally specific, and responsive, and can sometimes be that conduit or that in-between in a language that a member is familiar with, in a culturally specific way that the member can help connect to services that are maybe unfamiliar. Some of those activities are available now, as I said, but there's expanded services on November 1st that are really specific to housing. And as I said here, you see some examples like resource navigation, legal supports, peer supports, medical supports, and more. Next slide, please. Eligibility for HRSN is a little bit more straightforward. And so for these, we are relying on the presumption of eligibility. So that means that the provider believes that it is likely that the member is part of one of these groups based on the information that the member tells them. And they can still be reimbursed, even if the situation shows that actually that person didn't end up being eligible at the end of the day. For the additional services, we're still going to support that outreach and engagement. So the eligibility that I will walk through is being a current OHP member, part of an eligible group, has a clinical risk factor, and has a need for those additional services. If you go to the next slide, I'm going to break those down. So the first one is to be a current OHP member. As I stated, they have to be enrolled either in Open Card or a coordinated care organization. Next slide, please. They have to be part of an eligible group. So this is that list that I shared with you about the different transition populations of crossing systems, crossing age categories, where we know that there's a risk of not having that continuity of care or those connections. Next slide, please. They have to have one of those clinical risk factors. So you've seen that on a couple other slides as well, really trying to link this to improved health outcomes. And that's why we're thinking about this through our medical system. And then lastly, next slide, they have a need for these services. And so housing, nutrition, climate. Nutrition hasn't launched yet, will launch pretty soon, but we're really looking for that link that it's identified that they have this need. So next slide just reminds us of our eligibility recap for those outreach and engagement services. This is being done throughout the state by community-based organizations and CCOs and other partners that are in some cases population specific, some of them are statewide. We really are excited to see this new outreach and engagement opportunity to have a benefit in our program. Next slide, please. So I'm going to pause because we're going to talk about our community capacity building funds next, but I just want to make sure if there's any HRSN housing or outreach and engagement questions that we can answer them. It looks like we've done a lot in the chat, but I'm just going to pause and make sure that there's nothing else that we need to either talk through. Looks like Callie's on it. Great. Yes, we definitely have some definitions here. Some of them have come from work in our state to make that make sense to our own state, but a lot of it has also been handed to us from the federal government to be able to create some consistency in their reporting. Okay, I'm going to move ahead and talk about community capacity building funds and give that update. So if you recall, I think we haven't talked about these in a while, but these funds were provided by the Oregon Health Authority to the providers that we've been talking about of these new services and organizations that will become those providers. So nutrition providers, housing providers, climate providers, outreach and engagement providers. The coordinated care organizations administered this grant program earlier in 2024, and the funds are currently being sent to those awarded grant funds. And the funds are really supporting organizations to develop what they need to be able to deliver those services. So we are looking at training, IT, technology needs, hiring needs, all kinds of really exciting things that build capacity, build these organizations' ability to actually provide these housing services, outreach and engagement, et cetera. Next slide, please. As a summary, across Oregon, the 2024 grant program awarded more than $37 million to 161 organizations. We're still getting a little bit out the door still. We had 30 organizations receive awards from multiple CCOs, which is what we anticipated and expected to see. Different CCOs have gaps and needs in their networks, their provider networks. And so we wanted to see those organizations working in some cases across CCOs as needed. The CCOs received a set amount of funds to award, plus an additional amount that was based on their 2024 enrollment. And so that's how the awards were allocated out to the CCO to distribute. And then the CCOs have had to report on key elements of those organizations who applied and were awarded the grants to help inform future years of this, because we do have the opportunity to award more funds next year, recognizing that not all organizations that might be interested or capable of providing these services were ready to jump in the first year. Next slide, please. Here is our funding summary by CCO. So you'll see this was how the awards were distributed. We just wanted to be transparent about that. You'll see a range of grantees. So you'll see some CCOs might not look like they have a lot. That might also be because in certain regions, you only have a few providers who are even doing this type of work. And so we're really trying to support the capacity in all areas of the state, and that might need to look different in different areas of the state. So either way, it's really exciting to see the funding dispersed. And on the next slide, please, just some more information. We do know that CCOs awarded more funding to the organizations that provide housing benefits. That is a real stretch in our new benefit provision. And so we again anticipated that housing providers should be the ones receiving a lot of the benefits. Most of it went to support workforce development. It was granted relatively evenly across geographic regions, which we were happy to see. And most funding did go to organizations that already had a relationship with a CCO, but I think it was like a quarter of the awards went to organizations that didn't have any relationship previously with the CCO. So this is really good for us to see that expansion of relationships and partnerships across the state. Next slide, please. So this was our 2024 grant program. We will have a 2025 grant program as well. And just wanted to share that this is the type of information that's been informing how this went and how we might do this in the future. We've gotten lots of qualitative feedback from the CCOs and the partners, both those who have been funded and not. There was the CCBF application and funding data to help inform us. There was also a feedback survey that provided a lot of great data from the partners, those who were funded and those who were not. And the CCOs also took a survey on how the program went. So we're excited to see that. And if any of you were funded, we're happy to see those dollars going out the door. And hopefully that'll make a difference in our ability as a state to be able to support this work. Okay, so my last topic area today is on the climate benefit. If we can go to the next slide, please. Just wanted to remind you all about how we're doing here. Next slide. As a reminder, the climate benefit was a health-related social needs climate benefit that was aiming to keep people safe during extreme weather and wildfire smoke. It is available now. It launched in March of this year. And it provides air conditioners, heaters, and air filters to provide clean air and healthy temperatures in housing. Mini fridges to keep medication cold during a power outage for those who need cold medication. And then portable power supplies to operate medical equipment as well. And so that could be in a situation where, even we've seen preemptive shutdown of electricity in fire areas or high likelihood of fire areas. Saying that poorly, but I think you all understand what I'm trying to say. So that launched in March, and I'm going to share with you some of our data so far. On the next slide, please. We've had just about 1,700 devices delivered out to Oregon Health Plan members so far. Those 1,700 devices were given to 955 health plan members. 44% of the devices delivered were air conditioners. So you can see here that many people received more than one device as necessary and as their medical condition supported that need. So just want to share some of that with you. And the next slide, please. Our preliminary data from the early part of some of this work, which we have what's called a data lag, which means that we don't always get the data because it has to be properly validated and corrected and worked through. So this is for the first part of our climate launch program. You'll see the age distribution here, which is great to see. All members of all ages have benefited from these programs. 65% of the members were homeless or at risk of becoming homeless in that category. So great opportunity to, again, try to help stabilize and support someone's health conditions. And you'll see that most did receive climate devices in Multnomah County, 29%, but that there's a distribution across the state to different counties based on need. And it may align with some of our population settings, and it may also align with some of the higher fire risk, where I know that there's been a lot of activity to proactively go out and talk to members and ensure that they're getting devices. Okay. So with that, on our next slide, I believe we are just at our regular Q&A. I again see that everybody is active in the chat.
I do have a quick question, which is that the things in the chat won't make it into the recording. So are there any highlights that we want to share out loud so that it makes it?
Let's see.
I'll share one. My name's Callie Glenn Haley. I'm a part of the housing team with the 1115 waiver. Just highlighting that the at-risk of homelessness definition, we're using the HUD definition, and it includes 3 components. One is 30% of the area median income according to the latest HUD data. I put the link in the chat, but you can also find it online on HUD's website. Second, that the member self-attest to lacking resources or support networks to prevent homelessness. And then third is meeting any of the health conditions that Steph walked through, which you can also find on our website. And I also just want to highlight the HRSN service provider webpage. We put it in the chat. You could also find it through Googling. As more and more resources become available, we are posting to that website. You can also find links to provider technical assistance trainings and other things on that site. So just wanted to highlight that.
And I'm looking through, and one other thing I would highlight is that we are encouraging enrollment as an HRSN provider. If you are an organization that provides any of these services, even if you didn't get the capacity building funds, but you can provide the services, we are encouraging both enrollment with CCOs and with our open card program, which are usually pretty similar processes. And we're happy to help with that enrollment too, if that's needed.
Doing a quick check. I know sometimes people would prefer to raise their hands and ask us questions out loud. Want to see if there's anyone who'd like to use that functionality here in Zoom. And also, it's a lively chat. Thank you all so much. Keep up the questions, the comments, the suggestions. Brooklyn, I see your hand. Go ahead.
More like a reiteration. So this is already in play, some of them since March, according to my notes that we were, and then there was one talking about for high fire areas. Are those electrical generators that they were mentioning there, that Steph Jerem alluded to, that there would be some other source of electricity should you lose power?
Great question. Thank you. Yeah.
Thank you.
So first is that, yes, we are rolling these out over time. So Climate went live in March with those climate devices that I talked about, those air conditioners, etc. Housing launches November 1st, and then nutrition will be launching in January for a small set. I'm sure we're going to be talking about that next month. So that's the first part. Secondly, for your question about the generators, we just know that the generators, for anybody who is on a powered medical device and could be at risk of losing their electricity, that's what and otherwise meets our requirements, that's what we're wanting to see for support. And in some of those higher fire likelihood areas where there's sometimes preemptive shutoffs, I know that there's been proactive outreach to those members that we know are on electrically powered devices to ensure some connections there. I'm not saying it's perfect or that's been done everywhere, but I know that that's been one of the focus areas, is to just try to support those areas over the summer.
Okay, because there's also the motorized, almost 400-pound electric chairs that would be able to facilitate you getting out of an area should you need to go. And if there's blockages, I don't know, on the road or whatever, because we have a lot of construction everywhere. And they're living near the forest, or they just have to get to the next building because they know someone there that has motorized cars to go out of the area, just that. Would that qualify as having a generator if you have one of those wheelchairs?
We can confirm that. I don't believe so at this point in time, unless it's powered by a generator. The generator would be what's covered, not the chair.
Oh, yes. I mean, people with existing chairs already that they no longer now, let's say it just lost power for a little bit and they just need to give it that boost.
I think that I don't think we have any of our climate leads on right now to be able to support that. I'll pause. Jesse's here. Do you want to try to take that?
I just joined and I think I have the question, but if the power to power
I think to finish out on that, it sounds like someone like that may be eligible, and we would just encourage them to go through the process to see if they are eligible for the service. To me, that is the type of person that we're anticipating would have a need, and would just want to connect to the services to see if they're eligible. And there are self-referral forms as well, but we encourage you to partner with your CCO.
Okay, so to partner with the CCO, I'm just making this really simple for people. What they should do is call the number at the back of their card, their medical card, to reach someone that could connect them with this? Or is there like a general phone number or general link for them to keep handy in case of emergencies like those?
We would actually encourage proactive, like we don't want to wait for the emergency with this benefit, with any of these benefits. We're really hoping to get there before it becomes an emergency. And so we would encourage them to do exactly what you're saying, call their CCO number on the back, and they can help direct them to that eligibility form.
So you're encouraging they sign up ASAP because the world is changing so quickly and things are happening. There's evacuations in Florida, et cetera. There's going to be fires and so on. So they should preliminarily do it now. Don't wait until tomorrow.
That's right.
Thank you so much. This is very encouraging, hopeful information. And some of them have started in March, as you mentioned, and some are starting in January and so on. This is very exciting. I'm so thankful for all the hard work that you all have been involved in.
Thank you. I appreciate that. And I think I appreciate your work too. I know everybody is in on this together to be able to actually get the benefits out there. We designed the program, but then the program doesn't work without everybody on the ground actually making it work. So thank you for that. Okay.
You're absolutely welcome. Go team.
I do see a question in the chat that I'm wondering, Jesse, if you would be able to answer. The question is, I saw that potential service users need to sign an information sharing authorization form in order for communication to move in a more cohesive manner. Would this be done during outreach, or is that the responsibility of the CCO?
Yep. Thanks. I was actually just typing in the chat, but I think I'll say it verbally as well so we can have it recorded. So this information sharing authorization form may not be necessary in every situation. It really depends on the relationship that the provider has with the CCO. It will likely be more required if you are an open card member, an open card provider serving members who are on open card or fee for service. So this information authorization form, what it allows is it allows that health plan, so it could be the CCO or it could be OHA, to refer the member to a service provider that can provide the HRSN service. And so in order to share that information on the member, we do need to have an information sharing authorization, at least for the open card side. And it depends, again, which CCO and what that CCO relationship or contract is like with the provider. So it may not be necessary in all situations. Let me know, Ethan, if you have additional questions or if that helps clarify.
Looks good. And then I also see a question around the website to enroll for these services. We encourage you to go to your CCO's website or work with a community partner that provides some of these services if you happen to already be connected to housing services. In many cases, they'll be able to help share as well. I hate to pass it off like that, because I understand that it'd be so much easier if everyone in the state could just go to one website, but really we're trying to know that each region has different resources and supports. And so the CCO is really the one who can support that in your region. So we encourage you to go to the CCO website. Rent is not available, I'll remind you, until after November 1st, and that will be based on screening processes and being able to go through that process and understand what the member needs are. And if you are an open card or fee for service member, then that is a little bit different. And I'm wondering, Jesse or Jessica, if you happen to know the best place to point someone for that. For open card, would they go to our website or would they need to go to like Accentra or IN?
I do believe, well, our website should have instructions for how to contact Accentra, but or Jesse, I saw you unmute yourself for a second.
And sorry, Steph, I may have missed part of that question. Are we asking for a contact for members or providers or both?
If a member was looking to be able to see if they qualify for services, what would be the best pathway?
Yeah, if they know that they are if they're know that they're in a CCO, they would contact their CCO. If they're not sure whether they're enrolled in the CCO or open card, they can contact OHA client services team, and we can put the numbers in the chat for that. If they know they are open card, then they would contact Accentra. So it really depends on the situation, but we can put the Accentra contact info and our client services contact there. It looks like Jessica has it for open card.
Great.
That's very helpful. Thank you so much.
Yeah. And we know, whenever we're starting a new program like this, there can be some bumps along the way. We anticipate that we'll see those in the early stages of this work as both the CCOs and the providers deal with the influx of requests and need. And so it's hard when you're talking about something like rent, which is very needed. But we do ask that folks are patient, and as we learn what all of the different processes look like around this. Medicaid as a program is a pretty process heavy program. There's a lot of requirements. And so this is why we're, trying this out and really want to see how we can help support the needs in our state. I think I will turn it back to Jessica if you want to do the closing slides.
Happy to. Thank you so much. All right, Damaris, can we get to the next slide, please? We have topics for our next 2 months. So just as a reminder, November 13th is our next Allcom webinar. We are going to be talking about Benefit Update Project, which is another part of the Medicaid waiver that we have talked less about, I think, in these forums, but is also, yeah, there's so much happening with the waiver, goodness. And then in December 11th is when we return to the nutrition, health-related social needs services. And there will be a lot of great information at both those sessions. We hope you can join us. The same registration that got you here today should get you into those other dates. I think we have one more slide. Just a reminder that you don't have to wait for this webinar to get in touch with us. And there's also a lot of great information on our website. We have this 1115 waiver.renewal@odhsoha.oregon.gov email address. Feel free to use that anytime. We also have our landing page for the waiver. We have a lot of other content and a lot of other sites there, including some went into the chat around HRSN specific resources. There's a climate specific website that has a lot of great information. We have that communication site that has our newsletter as well as all of our past webinar content in English and Spanish. And speaking of the newsletter, this final link here on this slide is specifically to get our waiver newsletter and get updates. I believe it's twice a month. I think our final slide is just our heartfelt thank you for continuing to engage with us, to letting us know where your questions and concerns are, and to learn along with us as we build something that is new and exciting. And I think with that, it's 10:55 and we can go ahead, we can close out. Thank you so much, Steph, Jesse. Thank you, Callie, for all the great housing specific information. Thanks to our captioner. Thank you, Damaris, for hosting us in your Zoom today. And we'll see you all next month.
Thank you for all the public. From all the public, thank you so much. Great meeting.
Thank you. All right, Damaris, I think you can stop recording and we can start closing out.